I am going to show you the process of just what it's like to be an essential worker, which actually I am. But I do know there's... I am an STNA, which in some states are called CNAs. I'm also a CNA, but it's like a step up from a CNA in the state that I live in because it has to be state tested. Really the only difference. Also, that is from wearing masks. Let's get this going. Okay, I've already washed my hands, but I got Dawn dish soap on them, and if you put them through the wash, they can shrink. So I'm washing them with dish soap. So these are the 2 masks I just cleaned. Sing it! These are the masks that I have. I think those are like the disposable ones that I don't use, but these ones that I can actually clean. These 2 just got cleaned. These ones I haven't worn. This is the only one with like an actual metal piece in it to stay on my nose, on like the bridge of my nose, but it also can be like block my breathing. So it's nice that I have options too. And they're all kind of cute. So, you know, at least if I'm going to have to wear a mask, might as well be cute. Okay, another thing is, I want to show you the process of like what I have to do when I get into work before I wash my hands, but after I wash my hands I can't show you any further. I need to put you away like prior to washing my hands because like can't contaminate. Yeah? Be careful. Almost there. Where are you going? You want to take a bath? Yes. You want to take a bath? No. Yes. You want to take a bath? No. Do you want to take a bath? No. You don't want to take a bath? Do you love Mama? Yeah, Mama. What are you doing? What? Yeah? Oh, yeah? This is the OOTD. My shoes are downstairs because I don't bring the germs upstairs. I had a different scrub top on, but, you know, scrub jacket because it's a little chilly. The cloth mask of choice today is this pink one because I feel like it just kind of goes with it. This one doesn't have the nose piece, so it doesn't stay up very well at all. But this is the general look. I have hand sanitizer by my door for when you first walk in or out to need to get some germs killed. My shoes that I keep like by the door, I take them off as soon as I get in and I strip down right here. I haven't been taking a bag, but I needed to bring my schoolwork, and then I got a coffee because I'm working second shift instead of first, so I need to be able to push through this. So one thing that I read, and I don't know if it's true or not, is that like how not effective cloth masks are in comparison to like the normal medical masks, and then especially like the specialized masks. I'm sorry, I don't have the best terminology here. I think the N95s, if they're fitted right, are like the most effective from preventing spreading, but the fact that cloth masks are a very, very low percentage that it's like helping is sad because that's what we've had to resort to. And especially in like hearing about like surgeries and stuff to prevent infection there, and like it's sad that we don't have enough supplies for the people that actually need it, like the ones on the front line, because if everybody on the front line gets sick, then we're kind of in a sticky situation of oh, what are you gonna do then? Nobody take care of anybody. You know, the people that are essential workers still have to work, still getting exposed to it, still then coming home and bringing it to their families that are getting exposed to it. It's just crazy. So there's like a whole thing we have to go through when we first get here. So yeah, I can't tell you much because I have to scrub it and out every time. So don't want to lead to more contamination. Okay, so now it's Sunday. I filmed that on Good Friday, now it's Easter. I work today. I wanted to talk a little more about the virus and everything that's going on. I feel like a lot of the healthcare workers and police and essential workers like that get a little bit more credit than people that, like, grocery store workers that have to still work. And it's just really weird to me. I even asked, like, if anything like this has ever happened, anything similar, and it's just, like, crazy what's going on right now. Like, I can't even wrap my head around it. I mean, I'm so thankful that I can still work because, like, my mom claimed me on taxes for, like, from last year because I lived with her majority of last year. I just moved out on my own in October, which I can link that video in the eye. I think it's really great that there is, like, this stimulus money, whatever it is exactly, that's going to people. It just really sucks because if someone claims you as a dependent, they get nothing for you if you're over 18, as far as I'm aware. Granted, she also claimed my daughter because, again, we lived with her. So she should still get the money for her. I just think that it kind of sucks. But I guess I get it because if they're a dependent, then I don't know. I still feel like you should get, like, something because you're either paying for them or, you know, with my situation, she lived with me for the majority of the year. So she should still get the money for me, even if I'm not getting the money. Which irrelevant, should probably, like, give it to me because I do live on my own now. And I mean, I'm glad I don't have to worry about paying for my bills because I can still work. But also, it's really stressful because, so my grandma, if you guys don't know, is going through, like, cancer. She's now doing radiation, so I can't even go near her or anything, which, truthfully, her being older, and I probably wouldn't anyways with being potentially exposed to who knows what. Like, my mom's avoiding going around my grandparents too, but, like, my daughter can't even go around. And it's just even scarier because we can be as like safe as we want and take all the precautions that we want, but she has to go down to the cancer center to get her treatments if someone somehow manages to, like, if one of the staff gets themselves exposed from not taking proper precautions, and then, like, it can kill her. It can kill any of the cancer patients. It can kill anyone with, I mean, it can kill anyone that's healthy, but people that have a weaker immune system, especially where their immune system's, like, compromised. I don't have the best medical information since I am only an aide. As far as nursing homes, like, the aides are the ones that are, like, hands-on with the patients, like, a lot. Like, the nurses pass pills and help us with different things. We're the ones that are, like, brushing their teeth and everything else. And so I guess, like, the cloth masks make me nervous because we can't completely protect them from it because there's only so much the cloth mask can do. And that's what we have available to us. And then if I get it, I also can potentially be bringing it home to my daughter. My mom, who is getting my groceries and stuff, so I don't have to take my daughter out and expose her. But she's also potentially getting exposed from me, and there's only so much I can do to protect her and prevent it all. I mean, it's scary because I don't have the ability to just stay home and avoid everybody, which I honestly kind of wish I could do. But at the same time, that would have a lot more stress. But that's another thing. So since I am working, my schooling, and in school, it kind of became a mess because all my classes and stuff got switched to online, and I'm still working, so I didn't have enough time to, like, try to fix it all. I mean, luckily, I don't work that much, but if I was working full time, like, I just couldn't imagine it'd be so much more of a mess because I still have classes and everything. Like, I know that there's people that are actually, like, really struggling, and just know that I'm praying for you, whether that means something to you or not, and I'm sending good vibes and thoughts, but it's all crazy. I just can't even wrap my head around it. Put things into perspective because I am on the pathway to get into the nursing program. This is forever my life. I will forever be getting myself exposed and coming home to my family who will also be getting exposed to, you know, whatever viruses and stuff that I have been. And, like, that's just, it was just, like, kind of a reality check for me, and it made me, like, have to rethink why I want to do it because, you know, like, my aunt made a good point to me that, like, it's not just about the money. I mean, of course you need to be able to pay your bills and take care of your family, but you have to have more of a reason why, or going into the medical field is not worth it for what. I mean, there's so many reasons. You have to be doing it for the right reasons, or it just isn't gonna work. It's not gonna last, or you're gonna be miserable, or it's just crazy. Like, my family is, like, really worried right now because I do have not the best immune system. I don't have anything specifically wrong with me, but I just get sick really easily, and I don't really have a logic as to why, but I do, and my family's just worried about me getting it. I have asthma and I have some breathing troubles as is, so, you know, if I get the virus, I just don't know how. One, I can't do my job to pay my bills, which, you know, others are struggling with anyways, irrelevant to the virus. And then, I mean, I've seen how bad it can get. It's just scary. I mean, I had influenza when I was pregnant in my first trimester, and I had a fever and everything. I mean, it was scary. It was like two types of influenza, I guess, like A and B, and I had, like, the one that was worse. I don't really know. Maybe I'll know more about this once I go further in the medical field, but as of right now, I just wanted kind of a talk with you guys about it. And yeah, so that's kind of what it's like, thoughts behind this. Here's how like my work is doing like the precautions. There's tape to keep stuff 6 feet apart, and we all go in through the same door, put in a code, we go in, we scrub in, take our temperatures, sign a paper saying like what our temperature was and everything, and we clock in, and then, you know, all this is touching it with clean hands. Put our masks on. I know I showed you guys me putting on my mask at home. It's a little bit of a weird situation. I didn't know they were hanging it up yet, so like, yes, that was like not the best. You know, my unit's a bit secluded from it because it's a lockdown unit, but yeah, I don't really know how to explain all that. It's just that, like, you know, that's how it is, and then we leave and go to our units and do our job. Otherwise, it's just doing the same precautions as we should anyways. It's just wearing a mask the whole time while doing it, and having to like really remember to like watch your cross-contamination too. Anyways, I hope you guys are all staying safe. I'm praying for you all. Thank you so much for watching. Don't forget to like this video. Send positive vibes and prayers to all those out there. Bye guys. Our masks fall on the floor and all kinds of other stuff throughout the day, so it's kind of just like, there's only so much we can do. If we had the actual like medical masks, they'd stay and we wouldn't really have that problem, but gotta do with what we got.